How's it going, guys? I'm going to be doing my neurological assessment, and right now I have no patient because I'm home alone right now, and it's a tough time for everybody, including my family, with everything that's going on. So I'm doing it by myself, kind of doing it on my own. Um, Bear with me here. I'm not going to do an amazing job because I've had having a rough time, but I'm going to do it just because for the good of helping out my classmates if my assessment picks up on stuff that they didn't pick up, and I'll be doing what I can. So when I walk into a patient's room, I start by asking them questions. I inspect them for a lot of things. I ask them the person, time, place, and event, and then I also would ask them for just what's going on. I would inspect them. I would see what's going on, check out their gait, their posture, see if their speech is slurred or not. Usually it shouldn't be. If it's slurred, it can indicate trauma or maybe emotional trauma. I'd check out their memory, see if they remember what was going on before they came here. Check out their, what else can I check out? Their behavior, their appearance. Behavior and appearance are big because I know a patient isn't going to show up to a hospital in amazing, like looking amazing, like they're going to the Met Gala, but just that they're not in any obscene appearances, like they're not wearing anything crazy. They're wearing stuff, but wearing normal clothes. And again, I understand they're at a hospital. They're not going to the Met Gala, but just making sure that they look presentable, kind of. Check out their facial expressions. Check out their memory. Yeah. Alert and oriented ×3 would be the documentation for that, and then anything abnormal I would document would be about the following things I just listed: their gait, their posture, their speech, their behaviors, their appearance, and anything of that nature. See what kind of effect anything would have on them if talking about something would be tough. Basically, just making sure that we know that their brain is working. Next up, I'll be doing the cranial nerves, and I have this paper just to give me the rundown of the acronym because I kind of don't remember the acronym. I've been doing a lot of schoolwork recently, so I gotta keeping it. So Arnold Olympus, towering tops, a fin, and in German, viewed some hops. So cranial nerve number 1, ocular motor. That would be that's olfactory. That's smell. So what I would do is I would grab a scented candle or like a little bottle of vanilla extract, and I would put it up their nose and see if they could identify the smell. And that would be olfactory. Make sure that the smell sense is intact. I would document that as such and that it's intact and it's working on old Olympus. So the optic nerve, number 2, that would be to make sure that they can just pretty much see. Having them look at something from a distance. If you have the poster of the words on the wall, ask if they can read it. And then I would grab the ophthalmoscope, which is a great instrument to use in a clinical setting, and I would just put that near the eye. I'd have them open up their eyes. I would put it there, and I would inspect the inner portions of the eye to make sure that that all the structures are in place, like the optic disc, optic nerve, fovea centralis, the retina, the pupil. There's no scratching on the cornea because corneas being scratched are common, I feel, out of a lot of the eye problems. I know I had a couple scratched corneas when I played sports, and that's pretty much the optic nerve, basic sight. All right, towering tops of fin. Okay. So next, I'm going to be testing out the cranial nerve 3, 4, and 6, and I'm going to be skipping the facial nerve or the trigeminal because that doesn't really involve the eye movement, and the eye movement's what I want to do. So cranial nerve 3, 4, and 6. That's trochlear, trigeminal, or no, that's ocular motor, trochlea, and abducens. Okay. So what I would have them do in that case, I would have them I would put a pen light up to their eye. Start off, make sure pupils constrict, and then what I would do next is I would have them follow my finger from left to right, and then up and down, and make sure that the eyes and the muscles are working and that there's no obstructions or abnormalities with how they move their eyes, because that's pretty much all those what those nerves are used for. They're used for movement of the eyes. I know a friend of mine, he can't look to the right. I don't know why. He's had this problem for a long time. He's from high school, and he'd have to just turn his head whenever I'm on his right or his left. So a lot of that can be put into play. And then next, out of those nerves, I'm testing out number 5 for cranial nerves, which is trigeminal. And trigeminal is used for mastication, muscles of the masseter, so temporal muscle, masseter muscle. Open up my mouth, bite down, make sure that they're all working, that they're all intact. I would also do sensory, which is sharp and dull. Let's imagine this portion of the pen light is sharp, or I would close my eyes, sharp. Opposite side is soft, dull. And that would be the sensory for trigeminal, along with the mastication muscles, make sure they're working for the motor. Next up after that would be, let's see, I would do the facial, and the facial is having them smile, frown, puff out their cheeks. That would be the facial nerve. Next, I would do the acoustic, and the acoustic is pretty much what I've been doing the whole entire time. I've been talking to the patient, making sure that they know what is going on, and making sure that they can hear me. Because if they haven't heard me for this whole entire time, then what the heck have I been doing? You know. So acoustic is pretty much right from the crack of the gates. You walk in, you check out the acoustic cranial nerve as soon as you walk in. Next up would be glossopharyngeal, and the glossopharyngeal would involve movement of the tongue. And movement of the tongue, I would also test out the hypoglossal at this time, and along with the vagus. So I would have them open up their mouth, move their tongue left and right, and then I would do against resistance. I'm not going to touch this with my tongue because it's kind of gross. And then I would also test out their gag reflex, make sure that that's intact, that their uvula goes back when you stick a popsicle stick down their throat. And then I would make sure that their sensory is also up to par too. Have them taste something. But I don't know what I would give them in a clinical setting, because giving up food from a hospital, I wouldn't really like that. But make sure that they could taste. Let's see. Glossopharyngeal, hypoglossal, vagus, swallowing, yeah. Looking at this again, by the way. And then spinal accessory would be my last one that I would test out, and I would have them move their neck, move their head left and right, and then against resistance, do that both. And then have them shrug their shoulders by themselves, and then do that against resistance. And then if they can do that, the spinal accessory nerve is intact, and it should be functioning. So that's cranial nerves. Yeah, that's cranial nerves. And then what else we got? Okay, so then next would be the cerebellar function. Okay, so this one is so first make sure that they can walk, of course, because the cerebellum is mainly balance, equilibrium, that they can walk, their gait, their balance. I would have them stand up, put their feet together, arms at the side, see if they can like balance themselves. If they can, that's good. Then that means that their function's pretty good. The next test I would do would be the finger to nose test. So I would have my finger out here, have them touch their nose, point it to my finger, keep doing that, moving it from left to right to change it up. Maybe go up and down to make sure that their cerebellum is also working in that sense. And then the next one is the heel to shin test, where I have them. This one's hard to show, so I'd have them. Give me 1 second. Oh. Okay. I really hope you can see me. I should have put the camera on the other way. I'm gonna change this after. So what I would do for the heel to shin test, I don't know if you see this. I'd have my heel run up against my shin, making sure that I could keep balance. I'm wearing kind of high top shoes right now, so that could be why I can't balance. I'm wearing Uggs because I'm a girl. I'm kind of like a girl, honestly. And then might as well do this while I have the flash on. I would have them do the graphist, and then that would be all I would do for the cerebellum functions. And next, I would have them do the graphesthesia. So let me just grab a pen real quick. Okay, so let's just say for time's sake, I would write something on I would write the number 10 on my hand. Hold this up to the patient's head or face, have them read that number off. That'd be the graphesthesia, and then the stereogenosis would be putting a familiar. Just had lunch. So this is let's see, I'll put a water bottle. Let's say water bottle. I would have them close their eyes. I would put the water bottle in their hand. I would ask them, "What is this?" And they'd say, "Oh, it's a water bottle." And if that's intact, then their sensory perception's also intact. Okay. Okay, so I did everything else. I did cerebellum, I did sensory. Last thing I got to do is deep tendon reflexes. So, of course, I'm going to start off by just having the patient be moving their body a little bit because you got to do all the stuff. The biceps, the triceps, the brachioradialis, the patella, your knee, the Achilles towards the bottom of your leg. Kevin Durant tore that in his game against Golden State, or against the Raptors last NBA Finals. So what I'd have them do, maybe do a curl, maybe bring their arms down like this. For their Achilles, I'd have them stand up on their tippy toes, see if it's working, and there's no abnormalities right here. It's right here, but you would see the rupture go all the way down. And then for their patella, I would have them bring their leg in, maybe put their leg up on a surface and extend their leg, maybe just to test out if this is working. Maybe do something like this, have them bring it up, bring it down, bring it up, bring it down, both legs bilaterally. And then the next test I would run would be the plantar test. And the plantar test would be to put my foot up. I would run my hands up from the balls of my feet down to my heels. Let me see if I'm mixing that up. Stroke the heel to ball of foot. Okay. So I'd have them. Yeah, I would heel to ball of foot. So I would go to right here, go up. It would kind of be like you're tickling me. That's the way I thought about it. And if your toes were to curl in, that would be a good sign. And then if they were to flare out, that'd be abnormal. That's plantar. Kernig's test is where you would bring your legs up to your body, as such, both bilaterally at the same time, and then you have them bring them down, and that would be an indication of. And then if you were to bring them down and have pain, that would be abnormal. So you would not want an abnormal thing going on. So no pain should be visible. And then the last is Brudzinski. Brudzinski, that's his name. And that would be where you flex your neck. And then there shouldn't be any pain, I believe. So that's my neurological assessment.